Hello, everyone. I'm Michael Jones, president of the Medical Exercise Training Institute, and thank you for joining us. You're probably a medical exercise or a medical fitness professional, or you're a fitness professional working with clients with medical conditions. You're trying to get more information. Well, as president of the Medical Exercise Training Institute, back in 1994, we came up with an idea of how we could bridge the gap between healthcare and fitness. What we started to see then were our patients were gradually looking at a reduction in physical therapy visits with Medicare, Medicaid, also with workman's comp, and even private insurance carriers. We realized the most important aspect of what we were doing was the exercise component, and we needed to find a way of bridging that gap. We needed to find an individual that could provide safe and effective exercise for our clients after they left the clinical stay. They need to have an understanding of anatomy and pathology. They need to have an understanding of how to assess the client, how to progress the client and select safe exercises, but also how to communicate with the medical community. And that's what we did in our Medical Exercise Specialist Training Series. So now, some 32 years later, we're here, and we want to talk a little bit more about the last component, the ability to document and communicate effectively with medical providers. So let me give you an example. This is a common case study that we now see our medical exercise specialists that are managing. Mrs. Jacobs, this is a fictitious name. She's a 72-year-old female referred by her PCP and her son, primary care provider, and her son. It's not unusual for kids to refer their parents for exercise services when they're in their 60s and 70s. She's a former teacher and athlete. She's widowed, and she lives independently. She had a left total hip replacement done 4 months ago. It was a cemented anterior approach. She also had a right total knee replacement done in 1999 due to meniscal damage, and she also has lingering PFS, patellofemoral syndrome. She also has impingement syndrome and a right rotator cuff tear that occurred back in 2005 that was arthroscopically repaired in 2006. She has a history of congestive heart failure, diabetes, hypertension, Parkinson's, and osteopenia. She also has a cervical disc herniation at C6 that occurred as a result of a car accident that occurred back in 2002. She has right deltoid weakness as a result of that. She also has early stage lumbar stenosis with degenerative joint disease and mild numbness and tingling in her lower extremities. And she has right ankle instability due to playing multiple sports and having multiple ankle sprains. Does she sound familiar? Yes, many of you have seen her or bits and pieces of her. Now, think about this. If this were your favorite auntie, your favorite or is your grandmother, or even your mom, wouldn't you want that fitness professional working with them to communicate with their doctor, therapist, or chiropractor with regard to the exercise program to make sure it was safe and effective, and that medical provider could understand that information and also integrate it into their medical management? This becomes important, especially now with the number of individuals that are now entering the healthcare system that are over the age of 65, as well as the chronic disease crisis that's affecting us. So you can see this becomes important. Documentation and communication is a key, and that's what you're here for today. We're going to talk about the idea of document first, communicate clearly. This is the new MedX Pro standard. Now, we integrated documentation and communication in the first workshop we did, and we've integrated it across the board the last 32 years. We're doing this segment because we realize you need to do more with documentation and communication. That favorite aunt or uncle, if they're receiving exercise services after physical therapy, you want that trainer to communicate. So here's my question to you. How come you don't communicate? We're now going to give you some guidelines that you can utilize that will help you in establishing a documentation and communication system in your practice. Your certifications, your exercises do not impress doctors, therapists, and chiropractors. We don't know all the certifications, and we don't care about your certifications. They mean nothing to us. What we want to know is, will you effectively manage my client? Will you send me a report or an update periodically? And will you let me know if there's a problem? Now, I know a lot of you out there say, yeah, I kind of do. But if you're not doing it at a high professional level, you're losing referrals. And in some instances, you're losing the respect of the medical community. So for the next 55 minutes, we're going to talk about this idea of document first and communicate clearly. So let's get right into it. So one of the first things that has to occur is this idea of a shift. A shift from fitness to functional services, or focus on functional services. Now, I know if you're a personal trainer, you work on improving clients' fitness levels, their wellness levels, improving their strength, their flexibility, their cardiovascular capability. All fantastic, and definitely we need. But we also need you now to look at this client and say, if you are, or if you have a medical condition and it's limiting your functional capability, how can I use exercise to improve your level of function? And think about it, folks. That's what they're bugging the doctor and therapist about. They go to the doctor and like, hey, I want to go play golf again. I want to wear my high heels. I want to be able to go out in the garden and do things. But after this surgery or this injury or the condition, I'm limited. The doctor sends them to therapy. If they're covered by Medicare, they're going to get 30 days of therapy and then they're done. They've got to wait another 30-day period and they can be recertified. That's when they come to you. You're the bridge in that gap. And that makes a huge difference. Well, here's what we understand now. You've got to make a shift with that new medically based client. You've got to be able to assess them to make sure they're appropriate. But your shift also has to be in the idea of providing functional services. Medical exercise professionals must move beyond fitness. We now are managing functional improvement. And that requires that you have an operating system. You can't now function like a personal trainer, just keep it all in your head. You now have to have an operating system as to how you onboard new clients or how you intake them, how you now communicate with their doctor, therapist, or chiropractor. But along with that, how do you progress them? How do you document? How do you monitor? And then how do you give the doctor an update? So when you think about this, documentation is the foundation for the communication bridge. It's the bridge that allows you to communicate with the medical community. Function is the currency. Medical providers and payers don't speak fitness jargon. They speak the language of functional outcomes. And lastly, professionalism requires a system. You can't rely on your memory at the end of the day. You must have a repeatable system. And that's what we're going to talk about today. This idea of a MedX Pro operating system specifically for documentation and communication. So one thing we need to do first is establish the boundary of your medical exercise professional MedX Pro scope. This also applies to the medical fitness professional. We manage functional improvement. We do not practice any aspect of medicine. Now, as I've seen the proliferation of medical exercise and medical fitness professionals, it seems a lot of people now think they're taking the place of the physical therapist or the chiropractor or the medical provider, and they can now interject medical services. Let me make sure you are clear on this. As a medical fitness or medical exercise professional, you provide one modality and one modality only. That is exercise. You cannot provide any types of heat or ultrasound or electricity, even ice you cannot use. But you can use the greatest modality of them all, which is what? Exercise. So with that said, let's talk about a couple of things. Again, you manage functional improvement. You do not diagnose conditions. This is outside of your zone. So this is your zone or your scope right here. Diagnosing conditions? No, not even thinking about the idea or subtly mentioning the idea. Treat or prescribe therapy? No, nor do you provide any therapy services at all. Cure or correct pathologies. I know a lot of you are really into corrective exercise. I want to correct that. Technically by law, you really don't, but you can improve it significantly. And you're not designed to replace the licensed medical providers. When the insurance carrier cut the individual off, you now step in. You're providing that next level of service, but you're not taking the place of the medical provider. So within your scope is exercise management, client tolerance and response when you document, mobility, strength, and also stability, functional improvements and ADLs, as well as exercise progression. We're not trying to sound like physicians or therapists or chiropractors. We communicate clearly as exercise professionals for all functional outcomes. Now, folks, let me make sure you understand. The medical community wants functional outcomes. Functional outcomes are things that the medical community can measure. Heart rate, blood pressure, but also strength levels, range of motion, functional assessment scales. These are all things that are objectively measured, and every medical provider, as well as fitness provider, and even insurance carriers understand these numbers. And folks, these numbers now show the improvement based on the exercise program you're providing. So it becomes important, and it's vitally important for you to document where the client started in that first session, and then document utilizing functional outcome measures, the numbers, and then every 30 days, go back and revisit those functional outcome measures to see if the client is improved. This now shows your exercise program is effective to the physician, the therapist, the client, and if you ever have to deal with the client's insurance carrier, maybe the client is dealing with them directly, they just want copies of your documentation. When the insurance carrier sees these numbers, they have no problem reimbursing Mrs. Jacobs for it. So with that, let's keep going. You have to move from the fitness professional's idea of active logging to professional documentation. That means most fitness professionals, they're going to note sets, reps, and weight. Folks, I remember before I went to PT school, I thought I was a hotshot trainer, and I would always note sets and reps and the amount of weight. Well, once I finished PT school and I got in the real world, I had to document more. Now, we're not saying you're going to document like the physical therapist. And I'm going to talk about it in a few minutes. We do not recommend that you use SOAP notes. We recommend you use medical exercise training session logs. But it becomes important that you move beyond what the fitness professional thinks about just simply noting the exercise, the sets and reps, and the weight. So you must document exercise and the functional improvement. Give me an example here. Traditionally, as a fitness professional, you would focus on the activity, what was done. You would look at the metrics, the number of sets and reps and the weight. You would also look at the language, the client did well. And also the primary audience was yourself and the client. And when I say audience, when you document it, you were just looking at the information to look at yourself later and maybe share it with your client. As a medical exercise professional, ballgame changes. Now your focus is purpose. Why was it done? You have to have a rationale. This was done to improve quadriceps strength, to improve the client's ability to, say, climb stairs. The metrics, what was the client's functional tolerance, what was the response, and what was the progression? Gets a little bit more complicated, but easily done. The language now has to be objective. We're going to note tolerated without symptom increase. That's how we're going to document when the client is improving. But also your primary audience now becomes medical providers, doctors, therapists, chiropractors, and maybe even insurance carriers, and also the client. So you can see this idea of making the shift from activity logging, or just simply active logging as I call it, to this idea now of how do we document this more effectively so that the medical community can look at us and recognize us, give us the respect as those individuals that work on improving function after therapy services and other medical services are done. This will grow in need, I guarantee you, over the next 20 years because of the baby boomers. Folks, now I'm a Medicare recipient. I'm still working, but I have Medicare. And guess what? At some point, I'll probably have a total knee replacement. I'll have a total hip replacement. And with that, I know therapy is going to end. Even though I'm a therapist, it's going to be cut off at some point, and I'm going to need to come to you. But I need you to communicate with my doctor, therapist, and chiropractor and explain to them what you're doing, how it's improving. And if I say, hey, I'm going to deal with my insurance carrier, they say they'll reimburse me once I pay you, the medical exercise professional, I need your documentation to become clear and professional. So when I send it to them, they'll say, okay, Dr. Jones, we're going to reimburse you for the money you paid your trainer. That becomes important. It will become even more important over the next 20 years. So with that, document first. The session note compass. This is what you need to include when you document your sessions. Now, at the Medical Exercise Training Institute over at postrehab.com, we actually have a medical exercise specialist essential forms kit. It has all the essential forms that you need as a medical exercise professional, such as a progress report form, a session log form, a referral pad that you can send out to doctors, therapists, and chiropractors in your community, as well as other pieces of documentation and forms that are necessary for you to have. So we look at this idea of the session note in every aspect of medical exercise training. Exercise is never random. Every session note must answer 5 key questions. Number 1, the activity, what was done. Number 2, the rationale, why was it done? Number 3, the tolerance, how did the client respond? Number 4, the outcome, what function was addressed and improved? And then lastly, the progression, what should happen next? This now allows another medical exercise professional, let's say you're out and you on vacation, they can look at this and say, okay, I know exactly what went on. The insurance carrier, if I'm trying to get reimbursement as the client, it tells the insurance carrier exactly what was done. And along with that, you send this to their doctor, therapist, or chiropractor. They're going to glance over it, but it gives them a general idea of what you're doing and the progress you're making. Do not use just simply a workout log. We can't understand those things. Now, folks, the reason I'm doing this segment is because years ago, I did some consulting work for a number of insurance carriers. They bring in therapists occasionally to review other therapists' records. But in my case, they asked me to look at records coming in from health clubs and wellness centers. And folks, I can tell you, most of the time, these facilities were seeking reimbursement with just this, a workout log. It has sets and reps and weight. That's it. Folks, when I get these, I just throw them in the trash immediately. Because if you're just going to simply tell me that the client, you counted these reps, they did this much weight, why? There's no expertise there at all. Tell me the rationale. What was going on? Why did you do it? And how did the client improve? That now shows some type of professional intervention. Now, before we go any farther, let me make sure you're clear on this. You're not providing services to take the place of the therapist or the chiropractor or the medical provider. You're providing a next level of service that says we're going to actually help this client improve their level of function and or maintain it here. And we're going to do this at a more economical level. But with this, exercise is the key to long-term management of these medical conditions. And that becomes vitally important. So please remember, when you start looking at these session logs, you've got to answer a number of questions. What was done? Why was it done? How did the client respond? What function was addressed? And what should happen next? Those are all important. Those produce a professional report that now says, I'm no longer just simply throwing exercise at the client. I understand why. That's a higher level of professionalism, which is what we want. Now, as we move on, you also have to translate your fitness language. You'll be surprised. The medical community understands their medical speak language. They don't understand your language at all. And folks, let's be honest. You're playing in their sandbox. It's not your sandbox. It's their sandbox. So when you're playing in their sandbox, guess what? We play under the rules that they utilize, which means take a good medical terminology course. Learn medical abbreviations. Those are all in our medical exercise specialist course, but they're in any course. But with that, make sure you understand what the terminology means. Now, I know for a lot of you, we're talking about this idea of medical communication or communicating with doctors and therapists and chiropractors and documentation. You say, yeah, I do it. But when I normally have a coaching session with one of our medical exercise specialists, we really dig deep into why they're not getting more referrals. The problem always is they're not communicating, they're not documenting because they feel uncomfortable with the terminology. They don't want to say the wrong thing. Folks, the doctor's not going to ask you about medications or radiology reports or surgery. He or she's going to ask you about what? The thing that you do best, which is what? Exercise. That's what they're going to ask you about. But make sure you're able to take your fitness jargon and put it in terms the medical community understands. Let's take a look. Functional outcomes are the professional currency of the medical exercise professional. Folks, your currency when you're a trainer are all the exercises you know. Outcomes now are your currency. Those are the things that let you sit at the table with the doctor, therapist, or chiropractor. The client's range of motion improved. Great. Client strength levels improved. Great. But even more importantly, the client now is able to climb the stairs and their pain level now is at a 3 instead of a 7. And this is all after therapy is done. These numbers now, things that we can actually hold on to, we can look at, we can read, and we can measure that now allow you to say, I am a medical exercise professional and gain the recognition and respect of the medical community. So let's give you an idea. You've got to translate your gym jargon into currency. So we work legs today. Lower extremity strengthening to improve sit to stand tolerance and stair negotiation. Sounds impressive, doesn't it? And it is. With that, balance is getting better. Okay, kind of weak. Let's go to this one. Demonstrated improved static balance tolerance and required fewer upper extremity support contacts as they climb the stairs. Fantastic. Client did well. Now that's one we use all the time. Client completed session with mild fatigue, required 1 seated rest break, and reported no symptom increase. There you go. That shows now, this was a good session. And you've documented every session over a period of time. Now you're going to put these together into a progress report. The progress report now is a summary of everything that's been done in the progression that the client has made. But these individual reports are important because now let's say you go on vacation, you own a facility, you got other trainers working for you, they want to see what you did. They want to know exactly what you did. They don't want to guess. Now they can make variations, they can make use alternative or options, but give them an idea what's going on. Think about it. That favorite aunt you have who's down in Florida now, she goes to the physical therapist. Physical therapist goes on vacation for a week. Physical therapist leaves behind no reports. The next therapist is starting from scratch. Would you like that? You tell grandma or auntie, complain. Well, guess what? You're not keeping records. You're keeping it all in your head. And you went on vacation. Do you remember everything after you come back from vacation? So please, let's raise our level of professionalism. Let's raise it to that MedX Pro standard and say, now we're going to document, and we're going to document professionally, not only with what we're documenting, but with the language that we're using. So let's continue on here. Communicate clearly, the authorization gate. Now, I know a lot of you in many instances are reluctant about talking to the doctor, therapist, or chiropractor. Well, they're not going to talk to me. Yes, they will. Yeah, they will. Remember, they work for not the medical insurance carrier or for themselves. They work for their patient, your client. Now, let's make sure we get clear on something here. That individual you're providing medical exercise or medical fitness services for is never your patient. You are not a licensed medical provider. When you say patient, you now raise your standard to a higher level. That means you have to have a far greater understanding and a larger reference of information to call upon when you're working with the client, which means your error range now gets a lot smaller. So for that doctor, therapist, chiropractor, they're held to a higher level of responsibility. As a medical exercise professional, your amount of information that you must understand and apply isn't as great as theirs. Now, I'm not saying you don't have the ability to do what they do. Certainly go back to school and do it. But what I am saying is when you say patient, you're raising the standard that you must now abide by. That could put you in a bad situation if something happens. But let's just stick with the idea of you're working with the client. This is my client. So with that terminology, everything works. And you're not providing rehabilitation therapy or exercise therapy. You're not providing any therapy. Now, folks, I sat on the board of medical examiners when I was practicing actively. And utilizing the term therapy, unless you are a licensed therapist in most jurisdictions here in the United States, is not appropriate. Just say, I'm providing an exercise program. I'm providing a post-rehab program. I know you want to sound better. I know you want to sound more professional. You want to distance yourself from the other trainers, but don't do that at the possibility of running into the law. Now, I'll tell you a little story. Years ago, one of our best medical exercise specialists took a course where after she completed the course, they told her she was some type of like functional therapist. I don't know what it was. Well, she put it on her card. She called me and asked me, Dr. Mike, what do you think about this? I'm like, no, I wouldn't do that because that's going to cause some problems with the therapists in the community. She did it anyway. Calls back a couple of months later. Dr. Mike, I'm now facing charges from the State Board of Medical Examiners because they say I'm trying to impersonate being a therapist. Well, you put it on your card. The organization she received a certification from gave her no support at all. They turned the other way. They're like, hey, it's not our problem. We couldn't intervene, but what we did tell her was to make sure to clearly explain in the hearing that you were given this title, but you've never provided any aspect of therapy service and never even tried to by looking at all the other information you have on your website and in the brochures and things you pass out to people. She was exonerated, but $8,000 in legal fees later, she had to remove that from her website and off her business card. So be careful about utilizing the term therapy. That makes a huge difference. And that's one of the reasons why I came on to do this segment is because a lot of organizations are telling you things, but they've never been on a medical board to understand exactly why it's done. So be careful with that. Now, with that said, this authorization gate, okay? Professional communication requires permission. And you know where the permission is coming from? From your client. You need to get a release of information form. So never start without a written authorization. You know where the authorization is coming from? Authorization is coming from your client. It's not coming from the doctor or the therapist, it's coming from your client. Client says, yes, I give you authority and I authorize you to talk to my doctor, therapist, or chiropractor. Think about this, folks. You're talking to that medical provider about your client's medical records, their medical history, everything. That's maintained in their office. And does the doctor, therapist, or chiropractor own those records? No. They're the custodian of those records. That's why HIPAA becomes so important. They're the custodian of those records. The owner is the client. The client signs a release of information. That release of information says, okay, now you can go and talk to my doctor, therapist, and chiropractor. You either email that form over, you fax it over, you drop it off, and now you can get all the information you want. Because that medical provider is held to a federal standard that says they cannot give information to anyone unless they got written permission from that client. So make sure you get that release of information form. The rules of engagement. Identify the physician of record or the referral source. It could be a physical therapist, could be a chiropractor, physician, nurse practitioner. Identify them. And you're getting this information from the client and verifying it. Obtain a signed release of information before sharing any client data, but also the client is going to sign this, and you're going to need to actually forward this to the doctor, therapist, or chiropractor's office before they're going to talk to you at all. Next, communicate only relevant information related to the condition, the safety, and the progress. Now, let me add one other thing with this. We start looking at HIPAA guidelines. The HIPAA is designed to protect the patient/client and their demographic information. Folks, back in the late 1990s, there was just a massive fraud that occurred because in many instances, patients going to the hospital, they had their Medicare card, or Medicare was sending information to their mailing address. People were breaking into their mailboxes. Or in the hospital, nefarious people would get their Medicare information off their cards and use it for tons of other things. So that's why HIPAA becomes so important. Make sure you realize you're protecting your client when you make sure you get this release of information form signed. You make sure you protect your client's data by putting charts and apps and anything like that away so someone else that is not in your organization will see these things, because we want to protect their identity, especially for our seniors. They may not know things are going on. They may not understand a lot of these electronic things and other things that are going on. So you're part of the process of helping protect them. So with that, again, communicate only relevant information and maintain HIPAA conscious records. Okay, make sure you maintain them. One of our medical exercise specialists a few years ago was carrying his records around from client to client in a folder I should say not a folder, but a container that had folders in it in the back seat of his car. Well, guess what? The car was broken into. Who actually is the victim here? He is, yes, but his clients are, because now someone has that information and you never know what they're going to do for it. So use HIPAA compliant medical electronic record keeping systems so that you make sure your client's information is protected. Now, as a Medix Pro trainer, that authorization gate, that release of information form, you've got to get signed before you're going to have a chance to talk to the physician. Now, you may talk and have a general conversation, but they're not going to give you much information until you get that release of information form signed. Now, this is where I'm old school. On your phone, get a fax app so you can fax this thing directly to the doctor's office. Some of you probably say, a fax, Dr. Mike? What are you talking about? A fax machine? Folks, the fax is still one of the most effective tools for communication in the doctor's office. Give you an example. If you ever watch the show, I believe it's called The Pit, and you're looking at the nurses station there, they have faxes that are coming in all the time. They even did one episode where they went old school and they started sending faxes to everybody. Faxes are HIPAA compliant, and quite honestly, every office still has a fax machine. It may not be the traditional fax, but it's a computerized fax they have on their computers. So I recommend, if you are a medical exercise professional, you might want to look up and find an electronic fax you can put on your phone so you can send information to the doctor's office, but also send that form so you can sign by the client that now says they can talk to you. Make sure you remember that release of information form is usually good for 1 year. So if they signed it today, you need them to sign it again a year from now. All right? So let's keep going here. Our 1-page functional summary. This is that report I was talking about, that progress report. We're setting you up for something Let's talk about this progress report. Busy physicians do not need fitness jargon or long essays. Folks, I remember when I was a therapist, we had bought what was called a Cybex machine. And this thing was amazing. It was an isokinetic. Now, that was back in the late 1990s. We don't use isokinetics anymore. But this thing, its report was like 24 pages. It was in different colors. It was just fantastic. Well, I sent it to a good friend of mine after we tested one of his patients. And I sent it over to him, called him the next day. Hey, what'd you think of the report? He's like, man, I didn't have time to read that report. Just send me something with one page. Now, this guy was a good friend of mine. And I realized he's going from room to room to room. He can't read 24 pages. He can look at it later on. But right now, he doesn't have time to look at that thing. I get you. So with that said, make sure your report is 1 page maximum. You may have some attachments, supportive documents, but the report itself, 1 page. And at the bottom of that report, summarize it in bold so everyone can see it and move on to the next patient. Because think about it, in the doctor's office today, they're seeing anywhere from 30 to 50 patients just to keep the lights on, to keep everybody paid. So they're going in there and they don't need a novel. They need a synopsis, 1 page. All right. So starting point, where the client began post-rehab. Client started after they were discharged from physical therapy on June 18th, 2026. There you go. Your current focus, what functional limitations are being addressed? Tell them. Client has weakness with stair climbing. Client also has minimal balance impact, but it does make a difference when they're turning corners. The response, how the client is tolerating the program safely. Tell them, client is making progress. They're still having a little bit of instability with turning, but it has improved. On a 1 to 10 scale, it was a 2. Now they've moved up to a 5. Progress, the progress they're making. Objective changes in functional ability. Now, folks, this is where you're going to make your money right here. Showing the improvement, that makes the difference. Those numbers, those functional outcome measures, every doctor, therapist, chiropractor, researcher, insurance carrier, nurse understands functional outcome measures. These are range of motion, blood pressure, strength levels, distance walking, functional assessment scales. That's your moneymaker right there. That now shows, yes, the exercise program makes a difference. And when you report with those, I guarantee you over time, as you send in these 1 page progress reports, doctors going to start sending more people to you. The reason, folks, that is medical evidence. That's what they're looking for. That now moves you from a personal trainer and moves you into their realm. And you could have any title you want. You could be the master medical exercise specialist, but if you don't use those functional outcome measures, you're not getting your referrals. You could have no certification, but guess what? You now have these functional outcome measures. They're going to start sending people to you because you're speaking their language. They understand that. That becomes important. And then next steps. We always want to know what the plan is. Folks, the doctor doesn't know anything about the exercise program. He or she, they have no clue. And here's what you're going to say. Well, they should know. No, they shouldn't. They should know how to prescribe, how to do surgery, how to read an x-ray. Because when I go in there into the ER, that's what I want them to do. I don't want them to sit there and tell me about the exercise program I need. Leave that for the therapist and then for the medical exercise professionals. Doc, I need you to make sure you take care of the acute situation I'm in right now. So I never want to hear any of you say, well, the doctor should know exercise. No, they shouldn't. That's your job. And if they did know exercise, guess who would be out of a job? You would. And I'm not saying that to be rude, but I'm saying it to understand everyone has a place in the healthcare system. Excel at yours and realize what you know is what the physician doesn't and what they need. And let the physician know sometimes. Dr. Smith, I recommend that we put Mrs. Smith in a aquatic exercise program or get her a piece of equipment to use at home. They don't know. They have no idea. Help them out along the way. They want your help and they don't mind it at all. I guarantee you when you give them the functional outcome measures and your professional recommendations for advice on how to move the client along with exercise, I guarantee you they're going to look at you a lot differently. So this becomes important. That provider update, we're going to talk about this a little bit more. The provider update is vitally important. Now, building this Medix Pro operating system. This operating system is not just in your head. You now have mapped it out. So you add more trainers. You have contract trainers or employee trainers. Everybody's on the same sheet of music. So with this, professionalism now relies on a repeatable system. Folks, I learned this as a therapist. When I went out in my first practice, I probably had maybe 5 or 6 years experience. I was a great therapist. I'd done all the advanced manual therapy courses. I was board certified in orthopedics. I board certified in neurology and in sports medicine. I worked with a couple of college level and a couple of professional teams. I was ready to go. And patients were coming in. It was great. I was working with the patients. But folks, at the end of the day, I was a hot mess. I had reports that were waiting to be sent to insurance carriers. I got down to the point I was almost ready to close the doors because I just needed to send the reports to the insurance carriers to get paid. But I didn't have a system for it. And I realized I needed a system. So my mentor, gentleman who had trained me while I was in physical therapy school, came over and read me the Riot Act. Sit down one day and work on your systems. Your systems are more important to your practice than your skills are. You already have the skills. The practice now says you need to put systems in place so it runs smoothly. It runs smoothly all the time for every person coming in the door and every person leaving the door and every person who's referring to you so they can get the information they need. That will give you the recognition in the community. And folks, he was right. And I am so happy that he did that for me. So with that said, don't rely on your memory at the end of the day. So phase 1, make sure you have an intake and a clearance process, a medical clearance process. We have a thing called an METQ, Medical Exercise Training Questionnaire. It's similar to the PARQ, but it's specifically for those clients that have medical conditions. You run them through the questionnaire. You basically take them through. You do an oral interview and you take them through the questionnaire so you make sure you know what's going on. Anytime you give a client a questionnaire like the PARQ or anything like that, and they just check it off and you never read it again, guy can tell you he has an aneurysm. You never read it because let's be honest, you aren't going to read it. So make sure you review all this information. Their medical history, go through it with them. Do a musculoskeletal screening. Get a physician's release and then have the client sign the release of information form. Also, phase 2, the assessment. Get a baseline and then write a summary. Number 3, phase 3, make sure you use MedX Pro sessions logs. For each session, the client does a 1-page session log that notes what happened. Number 4, or phase 4, closing the loop. Make sure you use progress reports, 1-page progress reports. Send these things out every 30 days to the client's medical provider so they can keep track. Now, you're going to say, well, Dr. Mike, I sent the report, I never heard back. Did you really expect them to? It's not a novel. You're not trying to win the Pulitzer Prize. You're just trying to get them to understand, here's what we did, here's the client's progress. Think about it. They get a report from the radiologist. Do they call the radiologist and say, oh, great job, radiologist, send me more? No. They're standing in front of their patient. They've read your report. Great, fantastic. Let's go to the next patient. But then at the end of the day, when they now need to refer someone, who sent me that report? Oh, yeah, Susie Smith sent that report. We're going to refer her a patient. There you go. That's how it works. So that fax protocol I talked about earlier, right here, fax protocol is, guess what? I can fax information to the doctor's office. And folks, if you're ever in a location where they have a fax, when the fax machine goes off, guess what everybody does? They look for the fax. Oh, there's a fax coming in. That stays in their mind, and somebody at some point goes over and takes the fax off the machine, don't they? Yeah. Here's what happens to that fax. They pull the fax off the machine. Oh, this is from Mrs. Smith. We now need to, if it's an old school practice that still has some hard copies of records, they're going to pull the record, take that fax, paperclip it to the cover, and then put it on that provider's desk to review. And once that provider reviews the fax or the request in the fax, they're going to initial it, do whatever's necessary, and put it back in the chart and send it back to medical records. If it is an electronic system the medical provider is using, guess what's going to happen? Whoever reads it is going to flag it in the system, and when they sit down at the end of the day to review and do reports, they're going to get that red flag that says there's something in this client's file that needs to be addressed. That could be your report. And at the bottom of that report is whose names? Yours. Michael Jones, medical exercise specialist. They're going to remember that name, especially if you're doing it on an ongoing basis. Makes a lot of sense. And lastly, discharge summary. Folks, I'll tell you this, when we started the medical exercise specialist, and I think I get to say a lot about how medical exercise training works, it was not designed to last forever. See, some of you are blurring personal training and medical exercise training together. No. Medical exercise training is for the client that has significant functional deficits. We're going to use exercise because physical therapy is done. Once they get to the point they've reached their optimal level of function, we can now move them to personal training, and the personal training can continue to keep them at that level. But as long as they're making progress, medical exercise training, when they plateau off, we make sure they're stable. Now we can step them down to personal training. And at that point, we're going to write a discharge summary. It doesn't say you can't stop working with the client. It just simply says, now we're doing more of a maintenance. Folks, let me say this. Nothing in wellness or healthcare will last forever. It doesn't. No one likes that. And the reason we don't like that is because at some point we step back, we provide the services to the client, and we let them go on their own independently. Now, we know some people need ongoing services, but does it have to be at the level of medical exercise training? Or can we step them down to a thorough personal training program utilizing everything that we're using here, but at a different level? Because at that point, they plateau. Doesn't require the same amount of understanding that you have from our medical exercise specialist program. It now just simply says, I'm maintaining based on those exercises. But if I see a red flag or I see a problem, wait a minute. Let me put my medical exercise training hat on again. Let's take a look at this client. Let's determine if they need something else. And now let's see if they need to go back to the doctor, or can I communicate with the doctor and just resume the medical exercise training program? Got it? There we go. All right. So a couple of things with regard to establishing necessity and baselines. During that intake, make sure you determine the client's diagnoses, their functional limitations, and establish medical necessity. Medical necessity means the client needs this to continue to improve their level of function based on their medical condition. In that musculoskeletal screening, identify any movement restrictions, and I'll say functional restrictions. Now, if something is unreasonable, it doesn't look good, it doesn't smell good, don't get started anyway, call the doctor, okay? That's what he or she is trained for. You do not have the ability to determine, well, Mrs. Smith, that swelling that you have in your knee is not a big deal. That's the one that's going to get you in trouble down the road when you find out she had rheumatoid arthritis and you kept exercising her. That's not too good. So stay in your lane. Also, with the assessment, you're going to establish a baseline. Now, notice what we said here. Strength training, range of motion, functional limitations and concerns, and vital signs. Notice BP, HR. Okay? Heart rate. Now, I know some of you say, well, if your client is hypertensive, you should check blood pressure every time they come in the door. Period. End of story. If you're not, in my opinion, you should not provide anything or say you're providing anything along the lines of medical exercise or medical fitness. That's a given. You check their blood pressure. Okay? HR, check their heart rate. Check their blood pressure too. And I recommend not getting some $25 gizmo from Walmart. Get yourself a good blood pressure cuff, $60, $70, because you're telling people something that impacts their health. I'll go a step farther. If you are a certified medical exercise professional, medical fitness professional, you need to be able to take blood pressure with the stethoscope and the sphygmomanometer yourself. That is vitally important. That way, there is no ambiguity, there's no question. You checked it, that's the value. Now, Mrs. Smith, we're going to get started. Because if they come in with an exorbitantly high blood pressure value, they may not need to exercise that day. And I know you can say, well, am I going to get paid? But which one are we concerned about? Getting paid or the health of the client? And checking those blood pressure values, here's the thing. With those blood pressure values, over time, their blood pressure should do what? It will go down. If you're recording those and you're a smart medical exercise specialist and you're sending those reports out to the doctor along with the progress report for the blood pressure values for that month, those values start going down. Doctor says, guess what? We got some other people to refer to you. Folks, by giving them the information that you're gathering every day, you make your own self look good. And that goes beyond any certifications or degrees that you have. So this idea of the intake and the assessment, vitally important. Number 3, Your session log. Now we're going back to this again. Now I'm trying to reinforce this because this is the meat and potatoes. This is the functional equivalent to a medical appointment note that a doctor or therapist might write. Now, it's designed for specific for medical exercise professionals. Do not use SOAP notes. I know people say, well, just use a SOAP note. No, let's just be honest. You're trying to be like the therapist or the nurse or the doctor. SOAP notes were not designed for you. And let me explain why. I may have mentioned earlier that occasionally they'll bring in physical therapists to review medical records. And I've done this a few times, and I've gotten medical records that have come in the reviews from health clubs or fitness professionals. They write a SOAP note. Well, here's what happens in most insurance carriers. Now, I'm not saying you need to seek insurance reimbursement. I'm just giving you an underlying reason as to why I wouldn't, even if there's no insurance involved, okay? So I'm not advocating for insurance reimbursement. But that SOAP note comes in. When the SOAP note comes in most insurance carrier workers' mind, and most of them are non-college graduates that have learned on the job in the insurance carrier what to look for with a claim. They have no medical background other than what they've learned through their job in the insurance carrier. So they're following the company line. That SOAP note comes in. Immediately with the SOAP note, they think medical provider. Where's the license number? Is it on the bill? No. Oh, okay. What do? Throw it in the trash or put it in that file over there. So I'm going to urge you. I know some of your lecturers are telling you, use a SOAP note. Wrong answer. Because I worked in the insurance carrier, do not use the SOAP note. Use a one-page session log. So everyone will know, here's where this is coming from. Here's what it's coming from, rather than getting confused and saying, well, is this a licensed medical provider? Where's their license number? We can't find it. We're going to put the claim on hold. Or it's going over to a doctor, therapist, or chiropractor. You got a SOAP note, and they're like, is this coming from another medical provider? Because in our world, that's where the SOAP notes come from. And I know the people trying to tell you that so you can now catch up and you can be recognized. Wrong answer. Be recognized for being the best in your field. And I highly recommend this session log. It's a one-page session log. Now notice what it includes here. The session goals. You can have up to 3 goals for the session. It allows you to include functional updates and improvements in things like their pain level, their range of motion level, things of that nature. It allows you to know exercise details, and also it allows you to know observation and plans for the next session on one page. You fill it out, guess what? You put it in the client's file, or it's an electronic document that's held on your computer. And again, if you go over to postrehab.com, you can find out where we actually sell these. Now, these MedX Pro session logs will allow you to accurately record client feedback, exercise data, and functional progress much better than a SOAP note will. I guarantee you, it will. I can tell you this, from being a physical therapist for 40 years plus, I'd rather use this myself as a therapist than to use a SOAP note. SOAP notes are a pain in the butt. Now, I know everybody wants to use a SOAP note because it's the cool thing to do, but I can tell you this, insurance carriers really don't like them, especially if you're a non-medical provider. So that session log, one page, these are some of the things you need to include in it. And then phase 4, this is all your MedX Pro operating system. Closing the loop, progress, and transition, okay? We talked about this a little bit earlier. Repeated referrals come from a system of regular objective updates. Folks, the very first time we referred a client out for personal training was in, I believe, 1992, 1993. We had a patient that came in to see us, and she had back surgery and she wanted to work with a trainer. Great. Told her, no problem. You have no restrictions here. Just don't do a lot of heavy lifting and excessive bending. She got started with the trainer. About 4 or 5 weeks later, the lady came back for a follow-up visit. She was doing great. About a week after that, I got a report from that trainer saying what the client was doing. That was even greater. So about 2 weeks later, we had a patient that came in. We were discharging, and we wanted her to work with someone to help her with weight loss. Guess what we did? I didn't know the trainer's name. I told my assistant, go back into the charts, check Mrs. So-and-so's record, and find out who that trainer was. Lo and behold, she brought that report to me. From that point on, that's who we referred to. We don't see a difference between trainers on the medical side. We don't. We know no difference between one that's got 50 certifications or one. We don't. What we do see is, are you communicating with us in the manner that we like? A professional, standardized manner that allows us to understand you do have some medical understanding, particularly numbers that we can observe that show the client is getting better. That's all we're looking for. So with that, you should have some type of progress report, one-page progress report that goes out every 30 days. It's a trigger. Every 30 days, client medical provider gets one. Number two, there's a follow-up visit. They're going back to their doctor, therapist, or chiropractor. Okay, that triggers a report. Or number three, their insurance carrier is asking the client for a report so they can know what's going on. You provide yours too. And anytime you're providing a report, you make sure that doctor of record, the therapist of record gets it too. Because remember earlier on, they signed that release of information form. Now, that progress report, one page. One page. This thing right here is going to be really the one that's going to make you money and get you more referrals. So remember, at some point, some of these clients need to be discharged. And when I say discharge, you're just stepping them down. You're going to keep working with them. They go from medical exercise training, which requires a higher level of understanding, now down to personal training. Okay? You're just going to hold the line. We're going to keep them right here. That makes a huge difference in the healthcare system, folks, I guarantee you. So this means, discharge means they've reached their optimal functional level. Their optimal functional level. You compare their final scores directly with the databases, if there's a database out there for their age, to prove their functional independence and share that information with their doctor. Also, you provide clear guidance shifting the client into independent wellness. So maybe you have group classes. Maybe they're going to see you once or twice a week instead of 3 or 4 times a week. Provide that transition and let the doctor, therapist, or chiropractor know. Folks in the medical community, we really don't like ongoing care. Some people need it. They must continue to see the doctor on a regular basis, 2 or 3 times a week, or therapy 2 or 3 times a week. We want to step them down. We want to actually make them more independent. Every one of us that holds a license wants to do that. And we expect the same thing of you. I think what has happened in the fitness industry, and I'm somewhat regretful of this, you now have a medical exercise specialist certification. It just allows you to charge more. And because they're medically based, you can charge longer. That's not how the idea was meant. The idea was meant to be one such that they will come to you for medical exercise training services for a period of time. Once they reach their optimal level of function based on your assessment of their functional outcome measures, then they now plateaued. We got them here. We're going to keep them here. Now we're going to step them down, not down functionally, but step them down from the standpoint of the services you're providing to now personal training services, which in my opinion are a lower level of professionalism or professional skills, not professionalism. That becomes important. So this idea of closing the loop, vitally, vitally important. What not to do. Some of the common mistakes. And this is going to make a big difference for you. Number one, you're documenting only exercises. You're omitting the why. Go back and look at your records. Some of you, your currency again is the exercise. That currency isn't going to get you in the door with the doctor, therapist, or chiropractor. Your rationale and the outcome measures are. Number two, you're exceeding professional scope. You're talking about their treatment, their diagnosis, and unless you are a massage therapist and you're incorporating massage in with the exercise program, yes. But all this other stuff, treatment, diagnosis, medical therapy, that's not in your purview. That's not in your ballpark. Leave that alone. Next one, sending excessive fitness jargon instead of functional summaries. Okay, we talked about that earlier, all right? Next one, communicating with providers without a signed release of information form. Okay, the therapist or the doctor or chiropractor is going to stop you on that, or their office manager is. So make sure you get that signed first. Failing to record client tolerance and symptom responses. Okay, you're just saying they did this, they did these exercises. We want to know why. That makes a difference. Your staff members that work with you want to know why. If they have to cover your client. And then lastly, lack of short-term goals, 30-day goals, and lack of long-term goals, 60 to 90-day goals. Folks, in a medical setting, we set goals. In 30 days, based on what we're going to do, the client should be here. In 60 days or 90 days, based on what we're going to do, the client should be here. And we work toward those goals utilizing our skill set. Same thing for you. Now, once the client reaches that 30-day goal, guess what? That 60 to 90-day goal becomes a new 30-day goal, and you add a new 90-day goal. So what you're looking for is you're striving toward improving, and then when they reach the maximum of what they can do, their optimal functional level, that's when now we can say, okay, you've plateaued here. Based on what they need to do in their lives, which you determined when they came to you initially, you can now say, okay, we're good to go. Okay? And you're going to send those reports back to the doctor, therapist, or chiropractor every 30 days. Now, I know you're saying, Dr. Mike, that's a lot of work. Yeah, it is. Yeah, it is. But it beats going out there every day, beating the bushes for new clients to come in the door when you got a doctor's office that's spilling over full of people down there, and you know the insurance carriers are cutting these people off, and some of them can't afford to pay your services. And you can even do group-based training, or you can do couples-based training. It makes sense, folks. That was the original idea we had back in 1994. But everyone wants to do it on their own and charge the highest level rates. You're missing out on a lot of folks that need your services that may not be able to pay $100. They could pay 60 or 70 bucks. Put them together, 2 people or a group. Guess what? You can do it. It makes sense. And the healthcare system and our medical community needs it. Now, 3 key takeaways for all of you, hopefully all of you. Number 1, no authorization, no communication. Get that release of information form signed, vitally important. Number 2, document purpose and tolerance, not talent, not just activity. Okay? Why did you do it? What was the rationale for it? Did it show improvement? And did the client tolerate it well? And then lastly, stay strictly within your scope. This is the one I'm finding more and more medical exercise and medical fitness professionals are going too far. Yeah, you went out and you took so-and-so's course, and they talked about doing this procedure, using this piece of equipment. Okay, you bought the piece of equipment. Doesn't mean that in your state, the Attorney General is going to tolerate you using it. So let me tell you how this works. You work with a client. Somebody sees you. You got an ultrasound unit. You got an electric stim unit. You bought one. You're like, okay, I can use this. Somebody sees you use it. Or the client tells somebody about it. They tell someone who is a physician. Oh, really? That physician says, and they tell the physician multiple times. That physician by law has to report it. That report goes in. The state medical board now has to investigate it, even if it's an anonymous call. They start poking around. They're going to call the client first. Do you honestly think that client is going to keep that a secret when the Attorney General's investigators call and says, Mrs. Smith, we have reason to believe that this has happened? Folks, they're going to give you up right away. You ever watch Law and Order? You put them in a room, close the door, they're going to tell. And then they're going to start asking you questions. They're going to get your cell phone records. They're going to get your computer. They're going to look at everything because you're now defrauding the public. And there may be a fine, probably no jail time, but you'll get a hefty fine. And you're now on the list. They're going to pay attention to you. It's not worth it. And I know you said, well, I bought it from the manufacturer. The manufacturer don't care, and they're not going to defend you in court. And folks, I've seen this happen multiple times. Here at the Medical Exercise Training Institute, we maintain very high ethical standards. Every time you renew your certification, you have to go through the ethics training. And with that being said, it keeps our medical exercise professionals out of harm's way. I know some other people are telling you, you can add this to your practice, you can add this. Make sure you check with your state medical board, or for our Canadian friends, your provincial board there. Let's keep going here. You should also have an initial checklist, okay? Use this checklist to begin upgrading your operating system today. Audit your current documentation, okay? Review recent client notes, all right? Along with that, do they state the rationale? Do they state the tolerance? Do they go far beyond sets and reps and weight? And do they tell next steps? And how vague are they? Do they use vague sentences or vague phrases? Build your workflow. This is that 10-point step system we talked about earlier, from intake all the way to discharge. And with that system, make sure everybody in your organization knows, and it's not just in your head, you wrote it down, and all the forms that are necessary are there too. I told you we have forms for you if you need them. And then lastly, standardized communication. This is probably the hardest one because this requires you do it on an ongoing basis, day by day. Establish a one-page functional provider update process that you can send out for all your authorized clients. And then with that, get all your clients authorized by getting them to sign a release of information form so you now can start talking to a doctor, therapist, or chiropractor. The doctor's never going to ask you about x-rays, pharmaceuticals, treatment. They're going to ask you one thing. How's the client doing with exercise? What do you think we should do? What should I do next? You're the one that's the professional. They don't know, and they're not supposed to know. Help them out. Now, our goal with all of this is to make you referral ready and reimbursement aware. Folks, we've certified thousands of medical exercise specialists, post-rehab conditioning specialists, medical exercise program directors, and our newest, our advanced medical exercise specialists. My goal as we move into the end of 2026 and beyond, into 2027 and beyond, we want to make sure you're referral ready, meaning that you can take a referral in from a doctor, therapist, or chiropractor. You will communicate effectively with them. You will have a system in place to bring that client on board in a professional, orderly manner and timely manner. With that, the client will get everything they need. You will now document and work with this client with what the exercise program entails, and you will send progress reports on a regular basis to their doctor, therapist, or chiropractor. It's a system. You set up on your phone, you set up on your computer, but everyone in your facility uses that system. Okay? That's referral ready. Just because the doctor sent them, it doesn't end at that point. You now have to have a professional engagement with that doctor, a professional management system for that client, and a means of communicating and documenting. Reimbursement ready. Now, I'm not saying as a medical exercise professional start billing insurance carriers. No. Even medical providers are running away from that. But you will have clients occasionally that will say, I need the necessary documentation to send it to my insurance carrier so they'll reimburse me. That's becoming bigger and bigger. That's reimbursement aware. That means you got to have the systems in place you have here for referral ready. Some of those same systems work over here. All right. This now says your practice is professional. It will be recognized by medical providers. They may not send every client, but they certainly understand you're more than just a local gym. Now remember this, most medical providers have had a nightmare scenario with the local gym. They sent a patient down to get some exercises. The patient came back mangled. I had that. That's how we got started with the whole medical exercise specialist certification. Patient came back from a trainer and she was mangled. We got on the phone and we wore that trainer out. But then later on I realized it was incumbent upon us, the medical providers, to provide the education. So with that said, the outcome of mastering the medical exercise or the MedX Pro operating system is a referral ready and reimbursement ready practice. You'll see the diagram down below, or you'll see the diagram in your handout. You might want to look at this. It talks about a number of different things, what referral ready is and what reimbursement ready looks like. I think this infographic is probably one of the best things that we've ever done. And this is what you need to strive toward. Now, with that, everything we've talked about, we put together a book recently. And with that new book that we just released, Beyond Fitness, it talks about this idea of putting systems in place. It's available over on Amazon. If you go to beyondfitnessbook.com, you should be able to get information there and then order it off of Amazon. The book is 347 pages. Each chapter has a checklist on how you put the systems in place necessary to build your practice. Now, the book is something that we did after we scheduled for this session. But we realized you guys are great at exercise. You are the best exercise clinicians out there. There's no doubt about it. You know more about exercise than I do, and I've been a therapist for 40 plus years. We don't argue that. The question is, can you harness your exercise skills so that now we, the medical professionals, will recognize your skill set utilizing a system that we can recognize and say, great, this guy's who I need to send Mrs. Smith to, rather than telling her to go home and do those exercises I gave her because I'm afraid to send her to the gym. I don't know who you are, Mr. Medical Exercise Professional. You look like every other trainer. Start talking and utilizing a system I can understand. I will send you everybody I have because there's a huge crisis out there. So with that, thank you for watching. If you need to get in touch with me, you can go over to postrehab.com. You can submit information there, or you can email me. There'll be some information down below at drmike@postrehab.com. Our 800 number is noted. We look forward to helping you. Again, if you're interested in forms, you can order those on the website. If you're interested in our certifications, go over to postrehab.com to get more information. It was my great pleasure to be here with you. I hope you learned something. And please email me at drmike@postrehab.com if you have any questions or comments or you want to have further engagement. Thank you again. All the best.